You've made it through this far, you've completed all 4 swabs, and now these are the swabbing pearls, these tips and tricks that I make sure I keep in mind when I'm swabbing, especially when I have a large volume to get done. So if you're going to wear a face shield, make sure you have a good seal on your mask, make sure you have something to wipe the fog with, and make sure that you get anti-fogging spray. That will help you tremendously. I personally just use goggles. That just pretty much eliminates the issue of fogging. If you have a large amount of patients to swab and not very much downtime between them, make sure you're using the double glove technique. For example, if you are a size medium, you're going to put on your medium gloves, and then you're going to put on a set of large gloves. You're going to wear those large gloves over to your patient and swab your patient. After you're done, you dispose of the large gloves and you use hand sanitizer. You get all the equipment that you need and you go to your next patient, and in front of them you can use hand sanitizer on the inner gloves and then put on another set of large gloves. That way the patient knows you're cleaning your gloves and you're also not reusing gloves. This will prevent any issues you face with putting on gloves with wet or clammy hands, especially if you're outdoors. Wearing gloves with sweaty palms, it's going to cripple your operation because it takes so long. Lastly, if you need to perform the oropharyngeal swab and then a nasopharyngeal swab, make sure you do the oropharyngeal swab before you do the nasopharyngeal swab. The reason for that is the nasopharyngeal swab requires a decent amount of time for the patient to recover because it is uncomfortable. They may not be ready for you to go ahead and just do an oropharyngeal swab right after. So I always tell people to perform the oropharyngeal swab and then perform the nasopharyngeal swab because the patient will probably be ready for the next swab. If you do the opposite way, it'll take time and you'll have to wait for the patient to recover. And the last thing about doing multiple swabs on a patient is that they can actually go in the same transport media. Now, if there's a special circumstance that there can't be, for example, if there's a separate code for each type of swab, then you can't do that. But generally, you'll be able to perform a nasopharyngeal swab and a oropharyngeal swab and place both samples in the same transport media. So that concludes this section. I hope that these pearls, these tips and tricks will help you in whatever context that you're performing these swabs. The next step is for you to pass the quiz. There are unlimited attempts, but make sure that you answer these questions and give it some thought because these questions are going to be the most important things that you have to know when swabbing these patients.